Good morning, everybody. How are you?
One of the greatest oxymorons in medicine is a gentle orthopedist. Is it bad? Is it good? Do I run? Do I stay? I think this is okay. Okay?
Your most common headache is your tension headache. And my guess is that almost every one of you in here at some point in time has had a tension headache.
Procenjuje se da u svakom momentu 650 miliona ljudi boluje od raka.
That patient gets referred to my clinic, my orthopedic office you just saw there. They get all their treatment, all their surgery, all their anesthesia, all their implants for free. He came back, and we had a CT scan of his neck and chest every time, and he had a little mass in his lung. So he had a part of his lung cut out.
Try not to skip the lectures. Just read them through. Maybe they will actually be helpful to you.
Right side of the brain. It's just sweeping, sweepy, sweepy.
Uhvatimo drugu stranu, izađemo sa druge strane, izvučemo konac i to je to.
If you're worried, am I in enemy mode right now? Just think about the other person, the other situation. As long as they lose, okay, I'm good. That's enemy mode.
When I was your age and when I was about to learn and study about immunology, I was like skipping the lectures. Boring. But at the end of the day, you know, when I graduated and started practicing medicine, everything waits for you. So
any decision you make in that mode is always going to be less best. Okay? It won't be the best. It may be okay, but it'll always be lesser than the best decision. Here's the question. So you have all weekend. The first one to come to me and give the answer gets the duck. Here's the question. Give me the 6 degrees of freedom of the knee joint.
Ono što mi u brzini radimo, uhvatimo ga gde stignemo i mlataramo i iglom i podemo se svi živi kada je neinfektivan pacijent, ali kada je infektivan pacijent vidjet ćete koliko svi vodimo računa o tome.
Does anybody want any more lectures? Danas smo za 180 studenta medicine organizovali radionice od običnog fizikalnog pregleda, neurološkog pregleda do nekih komplikovanijih tema i kejsova. Ono što nam je želja svakako da svi ti studenti izađu odavde sa dobrim znanjem koji će im posle pomoći u profesionalnoj karijeri i zaista nam je jako velika čast i zadovoljstvo da smo tolikom broju studenta podarili takvo iskustvo koje ti profesori iz Amerike nude sa svojih 20, 30 i 40 godina radnog iskustva.
The tenderness is going to be right there. And I know where I am because here's his joint line. I start anterior. I can follow the joint line between the femur and the tibia, and almost always the medial meniscal tears in the posterior third, and that's a very precise point.
The man who taught me medicine said if he had any choice between taking a history or a physical exam or anything else, he would choose history. Always history.
If it's not in your problem list, you will not make the diagnosis. You won't even think of the diagnosis. Or if you jump to a diagnosis without a careful differential diagnosis, you'll miss it.
You make a list of those so you don't forget them, because if you forget them, you often go wrong.
Lateral bending, that compresses the facet joints. If we suspect that there is a lumbar nerve root irritation of some kind, what we can do is we can, rather than stretch a muscle, we can try to stretch that nerve.
Now this will tell you an array of things, but I use it primarily to make sure that there's no very subtle weakness, because if there is, you'll see what we call a pronator drift. Well, I gave a talk, several talks this morning on the neurological exam. The students were all very, very receptive. paid close attention and they asked good questions. And I think it was a good time. Okay, this is good because it tells you something about her ability to do fine coordinated movements. It also tells you something about her strength. If she's just a little bit weak, you can't do that quite as well on the weak side. Now, bear in mind that some people are very right-hand dominant. And if they are, sometimes they'll do this better with their dominant hand than they'll do with their non-dominant hand.
In our area of our state, the best implant specialist is a periodontist, so which is ideal in this case because with the gingiva being a crucial part of this procedure, we needed his help to get a good aesthetic result. So people reflux, the esophagus was working right, shoots it out, but the acid is still there because the chemicals have coated the food pipe. And so when studying certain time measuring the acid levels, the pH levels, so you have reflux event, here pH in your esophagus drops to around 2. 7 is neutral, drops to 2. So it's dropped to 2. You swallow, and it goes up 1 to 1.5 points because your saliva has bicarbonate. Well, no, this is a great trip. We're so happy we're invited as part of this meeting right here. It's a fantastic way to make new friends, develop relationships, and teach about medicine at the same time. They have a lot of good students here in Serbia. Good questions, good interaction. My topic today was trauma. The one main point you want to remember, which comes to resuscitation. And with that, the students asked some really good questions, and hopefully down the road, we'll get a few trauma surgeons out of this group. So the CO2 production that's what your lungs are for. You have these big lungs to blow the CO2 off. Are you following what I'm saying? Yes. Okay, so in shock, you need to get oxygen there, but if you can't get the CO2 out, right? If you can't get rid of the nitrogen, what happens to the cells? They die.
So hopefully they all are encouraged, even now, wherever they're in medicine right now, in faculty or beginning practice, that they'll be developing their physical exam skills, their history skills, and especially the skills of a very thorough, careful problem list and an excellent differential diagnosis.
So we're going to do a box breathing. What you do with that is you're going to take a slow breath in. 4 breaths in. You're going to hold it for 4 counts. You're going to blow it out for 4 counts. You're going to hold it for 4 counts. So slowly breathe in. 3, 2, 1. Hold it. 3, 2, 1. Blow out. 3, 2, 1. Hold it. 3, 2, 1. In. 3, 2, 1. Hold it. 3, 2, 1. Blow it out. It's a simple little thing that starts to reconnect your brain. That dissociated discombobulated feeling. Okay, you've heard of like meditation, all these other things. All they're doing is taking their vagus nerve and just tweaking that little thing. This is a patient that's had a stroke, and they were sent to us to see what can we do for this person to get them to eat anymore. And you'll notice here, we're going to give them the smallest amount of applesauce. They don't know anything is there until it gets into the windpipe. And then they cough it out, and it goes right back down, then they cough it out, and it's right back down. This person has had several pneumonias, and this person is going to die of pneumonia if something's not done. There is no way to fix this otherwise. I mean, if the patient wants to live, you have to do something aggressive. So it's the kind of person that we would actually take their voice box out to save their lives. I'll tell you why. I'm going to start with my story. I'm going to tell you my story. The tragedy that I went through made me a better person. It made me a better physician, made me a more empathetic physician. And I had a knee dislocation, right, age 17. That means all my ligaments, well, you guys saw my anatomy lecture. I tore my ACL, my PCL, my MCL. I hinged on my LCL. Anyway, my knee was out of joint. Emergent surgery. Now, this is 1976, this is a long time ago. Did not have the modern techniques. So had emergency repair. It failed 6 months later. Had another surgery. I've actually had a total of 7 knee surgery. I will get a knee replacement soon. So sometime in the midst to all of this
difficulty. And again, I wanted to play sports like everybody else. But when that young person comes into my office and they have an injury that is life-changing for them, I've been there. You understand?
We've prepared the tooth. You can see the crown preparation there. Some of this odd-looking material, that's actually the cheek tissue. I think you'll see in a minute. So it's almost as if it's looking through the cheek, but you can see the teeth and it marks the bite on the teeth.
Even though the disc itself doesn't show up on x-ray, the space does, doesn't it? Yeah, so we can see narrowing of the disc. We can see irregularities of the end plate. We can see arthritis of those facet joints, those joints that are in the back part of the spine. So we can see all those things, the fractures we talked about.
So now I'm unclicked, it's open. I'm going to grasp my needle. You want to grasp it perpendicular, understand perpendicular. So the point of the needle's to my left, because we're going to sew this direction. And then when you suture, I want whoever's not suturing, one of you to volunteer to hold the towel. Okay, so you just make it stable. You're going to unclick your needle holder, and then you're going to grab it again and pull it through until there's about 3 or 4 centimeters left that you have not pulled through. Okay, if the suture's twice as long, you'll actually set the needle on the body. You'll come down here, grab the suture, okay, and then tie from there. These are short enough you can actually hold the needle. Now, this is important. Now I've got the needle in my left hand. Don't let go through the rest of the procedure. I start coming on top, you can come below. But if you come on top, you're gonna come around it twice. You're gonna take the left hand around your needle holder twice. You're gonna grab your suture. So your assistant can help you and bring you the suture, okay? And then you just pull your hands apart. If you pull them apart, it's gonna make a knot. And now I'll have a knot, I'm gonna repeat, and then you can try it the other way. Take your needle with your left hand. Don't let go with that. Okay, now you're gonna make another knot. I'm gonna shorten this because it's hard when it's this long. We actually do this sometimes. Your first one's too long. So pull this out, come over, wrap up. No, don't grab it. Come over, come around. Okay, you can just there you go, grab and pull hands apart. Okay, don't let go of that. Let go of that.
It took me 3 years to figure that out. I hope you all could be a lot faster.
This is a little bit of talking for our team to you, thanking you so much for this time, and a few closing kind of thoughts from us. I think you've come to know a lot about us. So this is a closing time from us as a team to thank you for the time that we've had with you. You've heard from some of the other doctors, you're excellent students. To really being excellent physicians in the years ahead, there's a lot involved in that, but you're outstanding students. We're very encouraged, and we're encouraged, we're even challenged by you. Your love for medicine, how hard you work, high things you think about. So it's been an absolute delight for us. So maybe we've been a help to you, but you've all been a blessing to us. So our team thanks you very much.
Like I said in 2019, this is not goodbye. I will see you again next year, maybe in the same hotel, maybe in a bigger place. We'll talk with Andy about if we're gonna push to maybe 300 medical students next year. So it was a great pleasure. It was an honor, and I hope that everybody here liked it. Follow our Instagram and Facebook pages for more information. This is definitely not the end. It's just a beginning of a beautiful story that will grow and that will become even better and better. Thank you very much.